Dogs with severe gingival recession, as you see on 203 and 204, the extraction may be fairly easy, but the closure is very tricky. So in this video I'm going to take you through each step, how you can extract these teeth, and most importantly, how you can close this defect without any tension. So first of all, I make a big semilunar incision. So basically we are removing all of the leftovers of the gingiva. We actually don't need this gingiva to close, so don't stress about it that it's not there, because after we have released this, you will see that you have more than enough tissue to close a defect like this. So once you make the incision, I use my periosteal elevator to pry off the mucosa from the bone. So make sure you scrape all the way down to the bone, and the sharper your periosteal elevator is, the more easily it will get off. And I decided to cut away this piece of gingiva because it's not really going to help us. We don't need it. So take that off. Next up is removing the bone, covering the root. And I use a surgical length cross-cut tapered fissure burr. It's called a 701L surgical length. And I like to use the side to cut because the surface of action is much bigger. So turn it kind of sideways and you can use the whole burr to cut the bone. And in that way I don't have to switch between a round burr and a straight burr. I can just use a straight burr for the whole extraction and just turn it sideways when I'm removing bone. So don't be afraid to remove a lot of bone, because it will make your extraction much easier. Now I make some grooves, so some modes or grooves between the bone and the root. And that will make it easier to insert my luxator or my elevator to elevate this tooth out of the socket. Now I use a fairly quick winged or fairly large winged elevator to make the tooth loose. And this spot, exact spot where I'm putting it right now, has a very dense, very compact and strong bone. So you could put a lot of pressure in this spot right here. And if it starts to bleed when you luxate, it's actually a good thing, because it means that the periosteal or the periodontal ligaments have been severed. So it's the ligament vessels starting to bleed, and it didn't take a lot of effort to get this loose. So next up is the third incisor. So we're just checking tension here, and you can see it's absolutely not possible to close this. It's full of tension due to the chronic nature of this lesion. So the periostal ligaments are extremely thickened and very dense. So now you want to clean up the defect, and you see all this granulation tissue that used to be on the inside of the canine tooth. So you cut that off. If you see a little bleeder like here, just apply a little bit of pressure and they will stop. So an important thing to do is to elevate the palate a little bit, and that there was a little oral nasal fistula right here for some reason. So just kind of try and clean it up a little bit. So pry the palatal part off the bone a little bit, just 5 millimeters, so you have enough to grab a good bite with your suture. If you do not loosen this part from the bone, your sutures will not go all the way through the palate. It will actually stay superficial, because in order to go through, you have to lift it up a little bit for the needle to pass underneath. And if it's still attached to the palate, then you may risk taking superficial bites that may open or pull through, so your wound will dehisce. So make sure that you loosen this part also, and get rid of any inflamed tissue. And I like to use a football burr, medium grit diamond football burr, to remove and debride the edge of the palatal here, so you can see all that inflamed tissue that is situated on the edge. Instead of using your scissor, you can actually pretty safely use a football burr like this, because it will not destroy your flap. It will just push the flap away, and instead of grabbing onto it and destroying it like a round burr would do. So it's very safe. So I use it to debride the edges from epithelial cells and granulation tissue, and that helps with healing. So you are suturing nicely fresh cut edges together. Here I'm just smoothing any bony spikes. I'm feeling with my finger if it's smooth or not. We don't want any spikes sticking out, so it needs to feel pretty smooth. I was happy with this. And this part you can just safely cut off. We like to trim the edges a little bit more, and this so we have a nice straight line to suture. And don't worry about cutting off all this gingiva. You don't really need it to close, and I will show you why. So to make a better release, I chose to make a vertical releasing incision right here. Don't worry about a little bit of bleeding. It will stop. If it's pulsating, you may want to address it, but oozing bleeding, don't spend too much time on that. It will stop. So I'm trying to lift it off here. So the trick is we want to release this part, and it's very, very thickened and irritated. So the technique you should use is grab a hold of the edge and just put a pair of scissors into that triangle. So right in this spot, and you can feel the first layer here. You can kind of see that my scissor is engaging in between layers. So we are in between the periosteum and the muscles right now. So here we are incising the periosteum, and this is normally not this thick. This is very, very thick periosteum. So make sure that you incise it all the way across your flap. And just have a look on the inside before you cut, just to see if we are cutting into any vessels, nerves, but we are not getting into nerves and vessels yet. This is just the periosteum. This gave us a little bit of more release, but you can see it's still not enough, because the rule of thumb is you need to be able to place the flap over the defect and it should stay there. If it pulls back like this, there's too much tension, so you could not close this right now. So we have to go one layer deeper, and now we are getting into some muscle fibers. There's a muscle called the buccinator, which raises the lip, and this can be safely incised too. So you can see, just go in there and with blunt dissection go in between the next layer and cut. And you can see already you got some more release. So extend your release here further back. And this is a nice trick when you can kind of see the scissor through the layer. You can almost see through it. Then you can easily spot for vessels, nerves, and so on coming out from the infraorbital bundle. So make sure that for every cut you open up your scissor and you check what does it look like, the tissue that I'm going to cut. So you also extend this to the full length of your flap, and you can do a little bit of a blunt dissection here. Okay, let's check. That's better. See, it stays. When I let go, it will actually stay over the defect. So I'm happy with that. The edge needs to be trimmed further because you see this inflamed tissue. This is the same type of tissue you see with cats with caudal stomatitis. You need to incise it, excise it. You need to cut it away to have a fresh edge to suture to. So your suture will not pull through and you will get a better healing. I was happy with the caudal part here, but the rostral part had a little bit of tension, so I'm just going to release that a little bit more. All right, I'm happy with that. Now we can close. So in this case, I choose to do a double layer closure because there was this little oral nasal fistula on the caudal part. Here I'm just flushing with some saline just to clean it out. Usually you can suture with a one layer closure, but if you want to be extra safe, a 2-layer closure is an option too, and I can show you one method of doing it. There are many ways to get the job done, and no way is really wrong as long as it's healing. And this dog had a history with compliance with the owner, so I was not sure that I would ever get to see this dog again for a checkup. So I wanted to make completely sure that this was really, really solid closure. So now I'm going to show you what I'm doing. I chose to do some tacking sutures, so start from the palatal side, and I grabbed onto a bite on the inside of the flap, and you can see how I'm doing it. So don't pull through, don't go through the flap, grab the inside here. And this is a tension relieving suture. So it's kind of a tacking mattress type of suture, where I leave the knot on the outside surface of the palate. You could have made a subcutaneous mattress suture, so to speak, where you left the knot inside the wound. That's an option too. This was what I did to make it tension relieving. So here we're just going to speed up the process a little bit. So I'm going to continue this pattern from caudal to rostral. It's always nice to suture from caudal to rostral. Always, that's a nice rule of thumb to do that. And for the second layer, I'm placing simple interrupted sutures. I'm using a 4/0 monochrome on a P3 reverse cutting needle. You can use the tapered needle too, but I prefer reverse cutting. And from here on, it's straightforward, just closing. Make sure you place the sutures about 3 to 4 millimeters apart. Cut the ends fairly short, and if you can leave the knots on the outside, the buccal surface, that's great, and it looks better. So thank you for watching. I hope you enjoyed the video, that you learned something. And if you want to see more videos like this, please subscribe to the channel. And I'll see you on here.